Here's the truth. Plastic surgery isn't a shortcut to weight loss, but used the right way, it can absolutely help complete the transformation you've worked hard to begin. In this video, I'm going to walk you through the process of preparing for plastic surgery, whether or not you'll need or want to lose weight for your surgery, how do medications like Ozempic work, and finally, what to do next if you're ready to move forward. Whether you're in the middle of your weight loss journey or just starting to consider your options, this video is here to give you a roadmap. Let's get into it. Hi, I'm Dr. Ramon Garza. I'm a board-certified plastic surgeon who specializes in complex breast reconstruction and aesthetic surgery of the breast and body. I make educational videos regarding plastic surgery. Let's clear up a common misunderstanding. Plastic surgery is not a weight loss tool. It's a sculpting tool, helping to refine your natural shape, especially when you're already close to your ideal weight. When we perform liposuction or a tummy tuck on a patient, rarely do we remove more than 4 to 5 pounds of fat from their midsection. While it can definitely reduce or smooth out certain areas, it won't change your overall body size. Now, if you're 10 to 15 pounds away from your ideal goal weight, that's not a major concern. But if you're looking to lose 50 pounds or more, you'll need to make some meaningful changes before having surgery. Let's talk about the current landscape of weight loss medications. GLP-1 medications specifically, such as Ozempic, Wegovy, and Monjauro, as these are being promoted almost everywhere you look in the weight loss space. These drugs do work, but they don't increase your metabolism or make you more active. In short, they can help reduce your calorie intake by mimicking the role of a natural hormone called GLP-1 that is produced by your body in response to eating. It suppresses your body's craving for food, meaning you'll want to eat less and therefore take in less calories. For some patients, this can be useful in the short term. Ultimately though, I don't think it's a good option for those who are looking for healthy, sustainable, long-lasting results. We know now that GLP-1 inhibitors like Ozempic have been reported to reduce muscle mass and bone density. Long-term effects of these drugs still need to be studied. Also, patients who go into the surgery while on these drugs may see poor healing, nutritional deficiencies, or disappointing long-term results. I think some patients who need significant weight loss can benefit from using these medications. But patients should also use this as an opportunity to change their eating habits so that they can ultimately wean off these medications and manage their weight with their own dietary habits and lifestyle. Without real commitment to change, most people who get off Ozempic and GLP-1 inhibitors gain back most of the weight. Before undergoing any body contouring procedures like a tummy tuck, liposuction, or body lift, we recommend your weight be stable for at least 3 to 6 months. After weight loss, the skin needs time to adjust. If your weight keeps changing, the skin might not retract optimally. A stable weight ensures your skin, fat distribution, and muscle tone have settled, so the surgical outcome looks better and lasts longer. The natural way is harder, but it builds a body that lasts. Eat fresh fruits, vegetables, and meat. Avoid bad seed oils, and reduce as much processed food as you can. Get regular movement, maintain a manageable calorie deficit, and most importantly, be consistent. I know it can seem basic, but if you can maintain these habits, you will see a radical transformation in your health. If you can combine short-term tools like Ozempic with real lifestyle changes, great. But if you're relying on a shortcut, you're setting yourself up for disappointment. Use these as a tool, not a crutch. Be sure to train your eating habits and develop consistency so you don't undo all the progress you've made when the medication stops. Finally, if there's one thing I could get across to every patient, I would say there is dignity in the work. When you lose weight the healthy way, through consistency, discipline, and care, you've already done something powerful for your body. After all that work and having finally achieved a healthy and strong body, your physique, unfortunately, may not reflect the effort and progress you've made. That's where plastic surgery comes in. Not as a cheat code, but as a way to reveal and refine what you've built. Especially for patients in their 30s to 50s, moms, professionals, and people reclaiming themselves after years of stress, aging, or setbacks, plastic surgery can be the final chapter of a much longer story. Take my mommy makeover patients. They've done the work, lost the baby weight, but they're still left with loose skin and muscle laxity. A tummy tuck and a little well-placed liposuction changes that, and often kickstarts even more motivation and discipline. Plastic surgery, done right, should honor the work you've done, not replace it. If you've already started your journey or are serious about making a change, we're here to help you finish strong. Check out our website or follow us on Instagram to see more stories like yours. And when you're ready, call us to schedule a consultation. Let's make sure your body reflects the life you're working hard to build.